slowing down, having little of the strength that I used to have, shortness of breath.
About a year and a half ago, Philip was diagnosed with COPD. Since then, his life has changed dramatically.
I used to swim and play tennis a lot, and I'm not good at them anymore.
COPD can have a tremendous impact on the patients as well as their families. Every time there's a flare or an exacerbation of their disease, there can be lost time from work, lost time from family, and an impact on society in general in terms of the cost to the healthcare system.
Since my breath is not as good as it used to be, this has led to weakening of my whole being, I would say.
When COPD symptoms get worse, it's called an exacerbation or a flare-up.
COPD exacerbations can be so severe that the patients need to be hospitalized.
Well, I went to the hospital because I really felt awful. I was having trouble breathing.
Every time a COPD patient has a flare-up or an exacerbation, that causes more inflammation and often a setback in their disease. It is very difficult sometimes to get them back to their normal or back to their baseline.
And I have noticed in the last year and a half that the condition has worsened.
In terms of their disease, we try to prevent exacerbations from occurring so that we can slow the progression of their disease, prevent them from getting worse.
Since COPD is progressive, identifying it early is ideal in disease management.
The first steps in managing a COPD patient is to target anything that's preventable. So if you're smoking, you have to quit smoking. We want to improve fitness and increase exercise capacity and also educate somebody about their disease. At the same time, when they have symptoms, we want to put them on inhalers to help them breathe better. We also want to vaccinate our patients against the pneumonia bacteria and against the flu each year. There are many challenges that patients face using their inhalers. Sometimes it's hard to know when the inhaler is empty. Sometimes it's hard to know when the inhaler actually delivered medicine. Also, some of the buttons can be a challenge for patients who are weak or have arthritis.
I wish pharmaceutical companies would make it easier to see how much is left in them. You can't tell how much is in it if you don't count exactly the number of days that you've got it and the number of times you use it each day. I hope I'm not throwing some medicine away.
What we try to do is match the best inhaler with those patients who require something different. So very often it does take a change of inhaler type or a change of the medicine, and sometimes both. There are many new treatments that have come out on the market recently which have had a modest improvement over what we've had before. The devices have made the greatest change, I think, in terms of being simple for the patients to use, to deliver the medicine more effectively to the lungs, and help them improve their quality of life. I think compliance is one of the hardest things we deal with. We prescribe these inhalers to our patients and we expect them to use it sometimes 8 puffs a day, and we expect their disease to get better based on that. But practically, it's hard for some of these patients to take the inhalers that often or that regularly. That's why some of these new inhalers that are taken only once a day or sometimes twice a day are very attractive for us to prescribe our patients who are having problems with their disease. It's very important for a patient who's having a hard time with their inhaler to go back to their physician and question whether they're on the most appropriate inhaler and whether they're using it correctly.
To manage it, I take my medicine as I should. I see the doctors as I should, and do my best to get some exercise.
It is essential that we increase COPD awareness so that we can make the diagnosis earlier and help our patients prevent or slow the progression of their disease.
To find out more about living with and managing COPD, speak with your doctor and go to healthandfamily.ca/breathe.